state of Arkansas, Democratic Governor Mike Beebe is proposing to use new Medicaid funding from Obamacare to buy health insurance for the poor from the private market. A little complicated, but interesting. The state has received a go-ahead from the Department of Health and Human Services to pursue the plan. Lower-income Americans would receive higher quality care from private insurers, but at a higher cost. Davy, the Republican Speaker of the Arkansas State House, joins me now with the details. Welcome to the show. Great to have you here. What's interesting about this is we've got a Democratic governor, Republican state legislature, and you guys are coming together on this. You've described the plan as moving the ball down the field. Tell me about this plan. Why is it so good in your view?
Well, Jerry, we have a lot of my colleagues have worked very hard on this issue over the last several weeks, and we feel like we're heading towards a framework of flexibility that's going to allow Arkansas to put more of our constituents in private pay, market-based plans. We think this is a good thing, and we think over the long run that we'll be able to do that and push the cost curve down on that entire population.
Well, to that point, the CBO came out recently saying they don't agree with that last thing you said. They say private insurance could cost as much as $9,000, Medicaid costs $6,000. This is health insurance price tags. How do you think you're going to get that number lower?
Our Surgeon General has come out with some numbers that are in that $5,500, $5,700 range. Frankly, we're still working through that, and that's something very important to the lawmakers, including myself. A lot of that's going to depend on what these policies cover.
The more they cover, the more expensive it's going to be. But what's interesting here is your idea is sort of catching fire, particularly in states with Republican governors. John Kasich in Ohio was thinking about doing this. It could go to Virginia. Could the federal government, though, afford to back this plan, because it's actually federal dollars that will be spent, if this were to catch on, if the CBO is right about the spending?
Right. Jerry, when we look at this in context of our existing population on a Medicaid program, in Arkansas it's between 750 and 800,000 citizens today. And what we're really talking about from 30,000 feet is how do we, can we fund 800,000 on the current system, or if we go to this model, it takes it to about $1.1 million on private pay options. And over the long term, we think that we can do that and push the overall cost curve down over the long run. So that's very important to us. I think unless we can save the state money and therefore the federal government money in the long run, then we probably won't.
Well, you've certainly got the advantage of bringing the private sector on this to get some cost savings. That'll be interesting to see if you can do. Thanks for coming on the show tonight, Speaker Carter. Appreciate your time.
You bet. Thanks for the invitation.
Well,